If you eat a meal at 9 p.m. versus 6 p.m., there's a measurable difference. You can take the same meal, but there's a measurable difference in terms of how high your glucose and how high your insulin goes. Same meal, same food.
Hello, my name is Lisa Chance, and I'm a fasting coach here at TFM, and we are here today with our very own Dr. Jason Fung for our monthly Q&A. In this monthly Q&A, Dr. Fung answers questions submitted by our TFM community members. And hello to our podcast listeners who will be able to listen to this Q&A with Dr. Fung in a few weeks after our regular community members. So, Dr. Fung, I'm going to dive right in here, and I had somebody send several questions in about LADA and the difference between that and type 1 diabetes and the diagnostic on that. And I realized that we really hadn't looked at MODY either. Is that how you pronounce it? M-O-D-Y?
MODY, yeah.
And I thought it would be nice if you could compare those three, type 1, LADA, and MODY, and tell us how you differentiate insulin level and fasting blood sugar levels.
Yeah, so there's really two types of diabetes, type 1 and type 2. And they're basically, when you say diabetes, it basically means that there's too much glucose in the blood, right? That's how it's diagnosed. But the pathophysiology is different between type 1 and type 2. Essentially, you have too much insulin in type 2 diabetes and too little insulin in type 1 diabetes. And it seems strange, but they both actually cause the same high blood glucose. So diabetes itself just means high blood glucose. You could have something completely separate like steroid-induced diabetes, which is caused by a certain medication. And that is separate, but again, it causes high blood sugars and therefore it's called diabetes. But the two main ones are type 1 and type 2. So too little insulin, too much insulin. The way you have to think of it is that insulin is the hormone that tells your body to take the sugar that's in the blood and then take it into the cells, and the cells are going to burn that for energy. So if you have type 1 diabetes, which is too little insulin, what you have is that you have all this sugar in the blood, but you don't have the insulin to open up the cell so that it can take the sugar inside the cell. So inside the cell, there's too little sugar. Outside the cell, there's too much sugar, right? So if you think about a bar or something like that. So imagine a bar and it's Super Bowl Sunday and everybody wants to go to the bar, but the bar has its doors locked. So insulin normally would open the door and allow all the people to go in. But if you don't have that, the door is locked, everybody's outside, right? Standing outside. So that's just like the glucose. The glucose is sitting outside the cell. Inside the cell, there's nobody there. But outside the cell, there's too many people there. So that mismatch is because there's no insulin. And that is type 1 diabetes. And that usually happens in kids, classically. Kids usually have this disease. So 10, 11 years old, it develops very quickly. And it's not a dietary condition. It's a autoimmune condition. So for some reason, and we don't know exactly why, their own body attacks the insulin producing cells in the pancreas. So therefore, they don't produce insulin. So therefore, they can't move the sugar from the outside to the inside. LADA is the same type 1 diabetes when it presents in adults. And it presents quite differently. So LADA is LADA, which is latent autoimmune disease in adults. So instead of a 10-year-old, what you see is like a 50-year-old. And the 50-year-old is relatively skinny because you don't have any of the sugar inside the cell. You don't have the overweight and all that sort of thing. So these people are not overweight because they're adults. It looks like type 2 diabetes, which is too much insulin, but they actually have too little insulin. So the only way to really tell is to measure the insulin levels. And what you find when you measure insulin levels is that what you do is you measure C-peptide, which is C-peptide is a different test, which indicates how much insulin goes up and down quite a bit, like bounces up and down like a yo-yo, whereas C-peptide is more stable. So you measure the C-peptide. And what you find is that it's relatively lower than you expect. So in type 2 diabetes, you expect very high levels. So you expect very high C-peptides. And in this disease, LADA, you see normal to low normal C-peptide levels. And what happens over time, because I've actually followed these patients for many, many years, you see this slow, gradual drop. And then everything makes sense. It's like, well, so in type 1, classic type 1, it's going to be like a 10-year-old. It's going to develop over like a month, right? It's going to be like, oh, boom, it happens all of a sudden. In a 50-year-old, which is LADA, it tends to happen older, and it tends to happen over decades. 5 years, 10 years, 15 years, you'll see this slow fall. For some reason we don't know of, it's becoming more and more common, and it's still felt to be autoimmune. So classically, you needed to measure the autoantibodies. So you would send off an antibody test and say, oh, we can detect these autoantibodies, and that's why I make the diagnosis. But it turns out that that's a very, very low sensitivity test. So you'll pick up maybe like 15, 20% of the people like that. In fact, most people won't have the autoantibodies that are testable because there's actually lots that you can develop. So that's LADA. And the thing about that is that because it's not caused by a dietary problem, you can't cure it with a dietary solution the same way you can with type 2 diabetes. With LADA, you can manage it because if your body doesn't produce as much insulin as it should, if you eat less carbohydrates and you do more fasting, well, you don't need as much insulin. So you can still manage it, but you're not going to cure that disease. There is some thought that longer fasting, 5 days, 7 days, may be helpful in terms of resetting the immune system. So perhaps there may be some benefit there, but that's questionable. Type 2 diabetes is classically in adults and somebody who's very overweight and heavy. And the idea is that there's too much insulin. And so how does that lead to all this excess glucose outside the cell? Again, if you think about that sports bar, this time the doors are open, right? So insulin is what opens the door. And the problem is that there's just too many people overall. So all the people from outside who want to get into the bar, they go in for the Super Bowl Sunday, but now the bar is completely full. So the people outside can't get in. So there's still a lot of people outside. But the reason they can't get in is not because the doors won't open. The doors will open, but the bar is full. Here, the cell is full of glucose. And even though insulin says, well, we have a lot of glucose in the blood, we want to push it into the cell. They can't push it into the cell because the cell is already full. So you have too much insulin. And in that case, which is classically 95% of adults have type 2 diabetes, then fasting and low carbohydrate diets are going to help because if you fast, your body is going to burn off some of the sugar. So therefore, the cell gets rid of some of the sugar. The sugar from the blood can now get into the cell, and that's going to help. So MODY stands for maturity onset diabetes of the young. So essentially what you have is a type 2 diabetes that's presenting much younger. So it's maturity onset diabetes because again, these used to be called type 1 and type 2 sort of tells you about the pathophysiology. So it's sort of like a type 2, but instead of in a 50-year-old, it presents in like a 12-year-old. And they usually have all the classic features. There's still type 1 and type 2, but there's this confusion between how it used to be. They used to call it juvenile diabetes and they used to call it maturity onset diabetes. So young people, old people was a differentiating. But you can have type 1 either in young or old, and you can have type 2 in either young or old. So it's still two types of diabetes, but how it presents is a little different.
You mentioned doing like a 5-day fast. If you catch it early, is there a possibility that you can stimulate your beta cells so that your C-peptide will go back up?
Possibly, yeah. For type 2 diabetes, the insulin levels are typically very high and then they actually go back down a little bit. And it was thought that that meant that it was a chronic and progressive disease. That's what they used to say about that. So in type 2 diabetes, your insulin levels are high, but not sky high as they are early on in the process. And that's because the pancreas starts to fill up with fat and then it clogs. So you get fatty liver, you get fatty pancreas as well. As you get rid of the fatty pancreas, it actually starts to release more insulin. So you actually see that insulin level go back up. That was demonstrated probably about 7 or 8 years ago now in a couple of studies, which were very good. The pancreas in type 2 diabetes gets clogged up. You can actually see it. My radiologist at our hospital also notes fatty pancreas all the time as well. So it's just less well known. But yeah, in type 2 diabetes, your pancreas is still producing a lot of insulin. It's just not as high as it used to be.
And what about stem cell? What's the study with using stem cells in the pancreatic area with the
There's been a lot of studies, but nothing definitive as far as I've seen. I haven't seen anything that said here's a very successful treatment and just give stem cells. Stem cells have been around for a long time actually. People use them for joint pains and all this sort of stuff, but they usually travel to like Thailand or something to do it. because most places here don't do it. And it's because most people here don't think it actually really does much. Like it might make you feel better, but it's like a placebo effect, right? So that's why most places here, like if you go to any of the university hospitals, they don't do stem cell treatments because they're not convinced that it works. So I'm not an expert on that, but I haven't seen anything convincing for type 1 diabetes. Certain autoimmune diseases, I've seen, and we've seen a lot of people with, say, Hashimoto's thyroiditis, they do the fasting and then the thyroid, they're like, oh, my thyroid's all better now. It's like, and it's possible that you reset the immune system with the fasting. Because again, remember, autoimmune diseases are your own body's immune system, which is overactive and attacking itself. When you fast, your body starts to sense that, hey, I need to start conserving my resources. I can't have all these cells active all the time. So one of the systems, including the immune system, sort of gets ramped down just to take care of any real problems. But because it's sort of ramping itself down, it may be that it reduces that autoinflammation.
Well, that leads right into our next question, which is, can you discuss the potential fasting protocols and diet for somebody who has autoimmune condition?
Yeah, that's a great question. And I think you actually have to go into the data. And the only data, and it's very preliminary, is with the longer fast. We were talking about this earlier in terms of these 5-day modified fasts, where if you go 5 to 7 days, then your body really starts to get that message that, hey, we really need to go into this sort of preservation mode. Let's not have too many cells active. So it looks like you have to go longer rather than like a 16, 18, 20-hour fast. Those may not do much. So when you go into a 5 or 7 day fast, there's some interesting data that suggests that you don't have to do a 0-calorie diet. You can actually preserve a lot of the benefits, even if you take a few hundred calories at a time. And we're putting together a protocol actually here at the Fasting Method where we're going to try and spell that out exactly what you're going to eat, what you're going to do. So hopefully, I talked to Megan about this, and we're hopefully going to start that in July or August. Give a protocol, and then we should be developing some products, a bone broth and some teas and some electrolytes to take with it, and then take a little bit of extra, sort of probably vegetables, could be some olives, could be some avocados. We're still developing it. And then that way we can get that sort of 5 to 7 day fast that we're going to hopefully all do together in the community and reap the benefits. That's the protocol that I've seen the most data on, is this sort of longer fasting periods. And it's possible that the immune system doesn't ramp down as quickly as some of the other systems, the metabolic systems, the insulin, the fat burning, all that we know how it works, right? You can get into ketosis and fat burning within 24 hours or faster if you're on a low carb diet. But the inflammatory ones, we don't know quite yet. But it seems like we have to go longer.
Thank you, Dr. Fung. This next question is it possible to be successful if you eat mostly vegan or vegetarian, as I worry about the higher carbs with this type of eating?
Yeah, so the carbohydrates, for sure, refined carbohydrates are a real problem, but a lot of people ate relatively high carbohydrate diets in the past without having obesity. So if you think about Chinese people and Japanese people, like they eat a lot of carbohydrates. You look at Japan now, they have one of the lowest rates of obesity in the world, and yet they're eating a lot of rice. And Italians have relatively low obesity. They're eating quite a bit of pasta. So there's other factors other than the total number of carbohydrates. And we've discussed this a couple of times. It's how quickly your body absorbs and digests that carbohydrate makes a big difference. So if you're eating white bread, which has got a whole number of bad things happening, commercial white bread. What they do is they take the wheat, they take out all the protein, they take out all the fat, they grind it into a very fine dust, and then you eat it with some jam. So carbohydrate on carbohydrate. When it goes into the stomach goes into the intestines, what you get is this 100% carbohydrate, but it's very finely ground up. And therefore, your glucose spikes like this, your insulin spikes like this, and then it crashes. So you go low and you're hungry. So then you go look for like a muffin or something. That isn't just because of carbohydrate. It's because of the way it's absorbed. There's been studies where if you take, say, steel cut oatmeal, which is also carbohydrates, however, it's absorbed much slower because it's not ground as fine. and if you eat it with other things. So there's a number of factors. I've written a couple of articles about it. I've done some YouTube videos about it. And my next book, which is going to be sort of follow-up to Obesity Code, talks about this speed of absorption. But essentially, if you take the wheat and you don't take out all the fiber, that's going to help slow down the absorption. So whole wheat breads. If you don't grind it so fine, then again, that slows down the absorption. And for all of these, you can measure how quickly this glucose rises, and it makes a big difference. So stone ground wheat instead. You can use things like pumpernickel. You can use acids, so vinegars, and then sourdough, which has a bit of acid in it, is going to also slow down the absorption by inactivating salivary amylases. If you eat carbohydrates with other foods, for example, like eating the carbohydrates last. So say you take some chicken breast and then you take the bread. But what happens is that in the stomach, when it all churns together, when the stomach releases a bit of food to the intestines, it's not like 100% carbohydrate. You got 50% chicken and 50% carbohydrate. Therefore, the glucose doesn't spike up like that. It gets smoothed out. And that makes a massive, massive difference. So the food order, and also things like how quickly you eat. If it's easy to chew, like a lot of ultra processed food, and easy to swallow, then it doesn't activate the satiety mechanisms. There's also how late you eat it. So if you eat a meal at 9 p.m. versus 6 p.m., there's a measurable difference. You can take the same meal, but there's a measurable difference in terms of how high your glucose and how high your insulin goes. Same meal, same food, right? So there's so many other factors that come into play when you're talking about carbohydrates or trying to incorporate those carbohydrates and still have a low. Like the key is not to have a big spike of glucose and insulin. And you can still do that by using some of these other things. Resistant starch is another factor. So fiber, cooking and then cooling rice increases the resistant starch. So there's a number of these factors. If you are vegan, it's harder. Eating beans, which have a much lower glycemic index, for example, that can make a big difference. So yeah, there's certainly a number of, total number of carbohydrates is one factor. So cutting down all carbohydrates, of course, is a good way to go. If you can't cut down all carbohydrates, then you can use these other things to still eat the carbohydrates, but have less, not zero, but less of that effect, right? If you eat zero carbohydrates, you'll have sort of zero effect of that. So that's great, but not everybody can do that. So if you still eat carbohydrates, there's still ways to bring it down. And that's why people in the 70s and 60s, they still eat carbohydrates. They're still eating potatoes and stuff, but there wasn't the same amount of obesity.
And one of the things you mentioned, I'm basically plant-based. I'm about 80% plant-based. So I do eat what I call meat on the side. And I don't usually go over 150. I find it hard to lose. Like Mark Sisson says, it's hard to lose weight if you're doing over 150. But I also look at net carbs as opposed to total carbs. So I'm including the fiber with that. And if you have a processed food, you got to go with total carbs. And if you're having a real food, whole food, you can go with net carbs. And what you said about late night eating, when I got my CGM, that's what I noticed, Dr. Fung. Man, I would eat the same thing in the daytime and it would not spike me like it would at night. It was amazing.
Yeah, the effect is quite large. I mean, if you simply think about the effect of eating late and changing your food order, for example, so instead of eating the bread up front, you change it to the back. You can reduce the effect of that insulin spike by like 60, 70%. And then if you add on, say, a walk after the meal, which again, there's good data on that as well. If you compare the effect of walking and you compare the effect of a meal, so walking before a meal versus walking after a meal, what you find is that if you walk before a meal, there's no difference in terms of how high your blood glucose goes up. If you walk after the meal, like immediately within 30 minutes of the meal, then you can reduce that by 20-ish%. And then the further you go, so if you walk like 60 minutes after a meal, you get much less of an effect. What's happening? Well, what's happening is that when you're walking, you've got all this glucose, right? Because your blood glucose is shooting up. But because you're using your muscles, your body actually helps disperse all that excess glucose in the muscles by using it off right away. So you don't have to store it and don't have to spike the insulin and all that. So even if you don't change the actual meal itself, you can still change the, eat earlier, eat slower, because that makes a difference. So eating slower, eating earlier, eating the carbs last, and then walking after a meal. You haven't changed the food at all, but yet you can reduce your insulin effect by like 60, 70%. If you actually change the food to use like stone ground instead of machine ground, and sourdough versus, there's all these various things. Pasta, for example, is much better than bread just because of the way the proteins are incorporated. So you can actually do quite well still eating carbohydrates.
This person asks, does each hour you fast have added benefits? Meaning, is 17 hours better than 16? Is 20 better than 19? That kind of thing.
In general, yes. The longer you go, remember that body fat or glucose is really just a way of storing excess calories. And fasting is the time you're going to allow your body to use those stored calories, whether it's sugar or fat. So the longer you go, the better you are. Where it starts to tip is the sort of psychological side. So if you start to go really long and then you start to get a lot of cravings, and then when you eat, you wind up binging. Well, that's not good, right? You're not supposed to do that. In which case, then you have to back it off. Or if you start doing long fasts and then you're always missing meals with your friends, and then you get depressed, and then you binge eat because you're depressed. Again, you screwed the whole thing up. That's not what you're supposed to do. We've seen so many mistakes, people doing fasting. They're not incorporating it in their life. I mean, that's why we have this community so people can share, right? Or they wait. And I've seen this so many times because this was put out by not us, but a lot of other people who jumped on that sort of fasting bandwagon, that they said, oh, well, I'll just fast for 16 hours and then I'll eat whatever I want. It's like, no, I don't think I've ever said that in my whole life. And we've never said that here. Megan's never said that because we've never promoted that. But other people, when they started saying, oh, okay, so I remember a couple of studies, they had people fast for 16 hours and then eat whatever they want. And then it's like, oh, we found no benefit. I'm thinking, yeah, because you did it all wrong because you didn't know what you're doing. And the point is that there are social factors, there are psychological factors. So if you wind up fasting too long and your body really can't handle it, you really get too hungry, and then you binge and you eat really bad stuff, well, then you're not doing yourself any good. Then you might as well go shorter or do something else like what we talk about with a lot of our fasting aids and stuff, fat fasting or doing this or doing that, or finding a group to create that social connection with. So there's a lot of nuances. In general, though, the longer you go, the better. You do have to take into account some of these other factors because they do play an important role. We saw so many mistakes, especially with the binge eating afterwards. And then it gave fasting for everybody a bad name. And it's like, yeah, that's because you listened to all these people online who jumped on the bandwagon and said, oh, fasting's great, fasting's great, fasting's great. And it's like, no, you got to apply it in the right direction while knowing what you're doing. There's a couple of very vocal proponents of fasting, and then they are like, oh, well, now they hate fasting. It's like, yeah, because you did the whole thing wrong, right? You didn't do it the way you're supposed to do it.
Yeah, there's a kind of a saying that goes around in our community, the best fast is the one you can do. And I always add on to that. The best fast is the one you can do and not overeat or binge when you break. And I have heard you say many, many times, you fast, and then when you eat, you go back to eating normal, your regular meal that you would eat, not making up for it in any way.
Yeah, and I think a lot of that is actually due to the mindset. So if you change your mindset, it's so important because once you change that mindset, then you can actually do that properly. Again, I talk about it in the next book, which is, and again, keep an eye out. A lot of this stuff is also going to be released on medium.com, which all the TFM members can get the friend link. I use it because it was very convenient at the time, but then they paywalled everything. So TFM has all the stuff to get me behind the paywall. So I'm releasing some of those things right now about ultra processed foods, but upcoming will be stuff about mindset that will come up in the upcoming book, but in the sort of unfinished version, we'll be able to get it. But the mindset plays a huge, huge, huge role. And that's why we've always emphasized the coaching and the working with somebody, because, if we could just tell you, do this, it's like, that's fine. But you may or may not do it just because if I tell you, oh, you should always change your fries for salad, that's good advice. I won't always do it, right? Because there's all these other things, but it's the mindset. The mindset of people who do that is that after I fast, I can now binge, right? And that's what's got to change. Until you change your mindset, you'll never change it. And we see it all the time. They think that, oh, all I have to do is fast. No, it only works when you change your mindsets and your behaviors, not just the knowledge itself of, oh, I should eat this, or I should eat this, or I should fast this long. That itself is not going to do anything, because if all you do is fast and create this mindset of deprivation, then you're going to binge afterwards and you're not going to be successful.
This person, I love it when people send me articles for you to read. It's like, I'm going to give Dr. Fung homework? I don't think so. But this person wanted to know if you happen to know about that recent study that was done in the University of Boulder, Colorado, which confirms that metabolically healthy women tend to experience menopause later. And I know you talked about how to fast around your cycle, and I'm going to put that hyperlink to that YouTube video in the show notes. But the study linked menopause, age 55, and to better vascular health, reduce heart disease risk. And they were really talking about factors like your mitochondrial function and health and insulin sensitivity. Can you comment on that?
Yeah, I mean, I'd have to look at, I can't remember the specific article, what they actually showed, but it makes sense because there is a link there between sex hormones, and that's what the YouTube video is talking about. There's actually a link between the sex hormones and how you deposit fat, for example. So if you look at estrogen, obviously there's a difference between, if you look at puberty, estrogen goes up in women and testosterone goes up in boys. So at the end of the whole process, women have more fat distributed in the hips and breasts, and the boys have more muscle. And that's not because of willpower or their diet. Their diets are like roughly the same going through. The boys wind up eating actually a hell of a lot more, but it all goes into developing muscle. That's why, because the testosterone is telling their body build muscle. As they build muscle, they're like, I need to eat more. So if you've ever had a teenage boy in your house, all your food just goes, right? And they're not eating that healthy or anything, but it's the hormones. So as you go with estrogen, it reduces. So during perimenopause, estrogen goes down, and estrogen acts as an appetite suppressant. So as you lose that estrogen, your appetite tends to go up. And that's when you start to eat more. And that's actually one of your highest periods in a woman's life where you're at highest risk of weight gain is actually perimenopause. So, this whole idea that's all about calories and willpower, it's so simplistic as to be stupid, right? I talked about that recently on some of the medium.com articles, but it's just, I can't believe people don't even understand that. It's just crazy that they accept this sort of idea of calories in, calories out, as if that's the only thing that's happening. It's like, oh, it's because, anyway, I won't get into that. But the point is that there's a link there. So if you fast, you may be able to influence some of those sex hormones, and then pushing out the menopause a bit longer may actually be helpful, because that there's actually a number of things that happen with estrogen, particularly with estrogen. The distribution of fat moves subcutaneous into the breasts and the hips, and less into the visceral fat, which is the stuff that we really, really worry about, right? That's the actual dangerous fat. So if you have a longer period where you have higher estrogen, then more of the fat is going to be subcutaneous as opposed to visceral. And that's why women in their premenopausal state have a much lower risk of heart disease than men. And this is well known. This has been known for decades. After menopause, so premenstrually, women and men have a much different rate of heart attacks and strokes. Women have way less. And that's probably because the estrogen shifts their metabolic profile to visceral fat, to subcutaneous fat. After menopause, that rate catches up. So in fact, women and men have heart attacks and strokes at the same rate post-menopause, because women no longer have that protection of the estrogen. So if your fasting can actually help you with maintain that, you're going to get less symptoms, right? All the perimenopausal symptoms. You're going to have less chance of weight gain, and you're going to have a lower risk of some of these diseases. So it's interesting, and it's not well studied, because the last 50 years, everybody's just been studying calories. This link between the sex hormones, estrogen, progesterone, and appetite, because where do they intersect? Classically, they don't. Insulin, glucagon, all those don't actually intersect with the sex hormones barely at all. They do, but very tangentially. But there may be much more to it than that. So if that study would be very interesting, because it would confirm what we've been saying all along, which is that one, it's all about the hormones, and two, fasting may be a very, very beneficial thing.
I'll put the link to the article too, also in the show notes. And the name of Dr. Fung's video is How to Eat and Fast Around the Menstrual Cycle and Perimenopause. It's a good one. I really liked it. You've got diagrams and everything showing all the things you just talked about. And somebody else also sent in a question about CAP scores. And you can find that on podcast number 202, where Dr. Fung addresses that, along with triglycerides to HDL ratio. So thank you so much, Dr. Fung, and I will see you next month.
Okay.
I'm looking forward to this fasting we're going to be doing coming up here in a couple of months.
Yeah. I think it'll be great, actually.
All right. Bye.
Bye.